I'm Elise Duchesne. I'm a full professor at Laval University, and I am also a researcher in the Interdisciplinary Neuromuscular Research Group.
I would like to know a little bit more about what you feel has been the most significant advance in the physiotherapy field in the last few years regarding myotonic dystrophy.
Yeah, a lot of things have been done, so it's very exciting to see that. But today I will focus on physical therapy advance. So beside all the drug development that is super cool, so there is also a very important part for be sure that people with DM1 are very well followed regarding their physical capacity.
Can you tell me a little bit more about what has been new about muscle strength training in the field of DM1?
Yeah, of course. So since the last, I would say, 10 years, a lot of things have been done. So, for example, papers began to say that it was safe to do exercise in DM1. And maybe this looks very simple, but it's very important because based on that, a lot of work have been done. So once researchers say, okay, it's safe, so now we can see what are the effects of different exercise type. So, for example, regarding muscle strength training, so we were able to use the same parameters than those that are used with LT individuals. I mean, those that are recommended by the American College of Sport Medicine. So we were able to train people with DM1 2 times a week with 6 to 8 repetition of 1 repetition maximum, which is quite a lot of load for people. And the attendance was very, very high. So we first did it by saying, okay, we will see. And maybe this pilot study will be more about feasibility of training. But at the end of the day, we were very surprised about the attendance and also the results of people. So both men and women improve muscle strength, functional capacity. And we also look at other outcome measure related to cognitive aspect of the disease, and people at the end of the training also improve their fatigue, so they were less fatigued, the apathy also decreased, and also the somnolence.
And what is, if a general practitioner or a neurologist or a physiotherapy less experienced with DM1, what are the steps to make sure that they can, recommend a training program to myotonic dystrophy patient?
Yeah, as you probably know, myotonic dystrophy type 1 is a multisystemic disease, so we need to work as a team. So the first step is to be sure that the authorization is obtained from the medical doctor, to be sure that all the other systems, I mean cardiovascular system, respiratory system, are clean and it's okay for the participant to train. And thereafter, the physical therapist can begin the rehabilitation. And for the prescription, so as I mentioned earlier, so it's the same than the American College of Sport Medicine. So 2 times a week, 3 series of 5 exercise, and for the repetition is 6 to 8 repetition of 1 repetition maximum for each exercise. And this has to be improved during the 12-week program. I mean that if the participant is able to lift more than 8 times, so the load has to be adjusted to be sure that the program is progressive.
Very interesting. And maybe one last point. We know that patients with DM1 have higher risk of falls, even 10 times more than the general population. How would you say that the role of the physical therapist in helping the patient to decrease his risk of fall and actual falls?
Yes, I think that muscle strengthening is one of the components that can be work as a physical therapist. Of course, muscle strengthening is not a balanced program, but we did some studies showing that muscle weakness is a factor for falls. So based on that, so muscle strengthening has a lot of benefits. So in addition to decrease the muscle weakness, it can also have a positive impact on falls.